Ladies and gentlemen, let me introduce. I am Andrea Dionisi. I'm working with the European Union, DG Sante, Health and Food, in the international bilateral relation. I have the pleasure today to lead you along the principle of regionalization and their effects on the international trade. It will be a long, but on the other side, even short introduction of what could be the effects of the application on international principle of regionalization on the trade. Let's start to have a look to what is the main animal health policy applied in the European Union, the main pillars of it. These policies come from the early 1960 years, where we start with all the member states. At the time there were only 10 member states, to set up the principles of the animal health and the veterinary control in the European Union. Since then we have developed very much the European legislation on animal health and all the correlated items, and then we bring all those pieces of legislation along the years, and finally a couple of years ago we had the adoption of the new animal health law, which is a massive piece of legislation which recap and streamline all the previous pieces of legislation. Our main pillar for dealing with animal health policies, it's really based on a solid management tool. Means that the European Commission and the 27 member states today can base their actions, policies, controls, management with the solid tools which are basis on the international standards. This relationship between the Commission services and the member states, it's really an interaction, lively interaction, which brings us really to have a solid and common policy on animal health. But the interaction between the Commission and member states cannot live alone. We need also a very strong cooperation with the neighbor countries. We call the GFTADS countries, but even at international and global level, means the OIE, Organisation Internationale des Epizooties, the World Health Organization in English. Means the body where all the countries, more than 168 today, are working together to develop common policies on animal health. Let's see the animal health disease controls in the EU. We focus mainly now in what is going on in Europe. This is a framework where we need a political consensus, because we have decided with our stakeholders, with our member of the European Parliament, with the member states and with our competent authorities to base our animal disease controls with the highest level of protection. We cannot downgrade this level. Those are the expectations by all the stakeholders. We work to have harmonized rules, which means that all the provisions are the same and applicable to all the 27 member states in the European Union. Those rules, of course, are based on the principles and standards of the World Organization for Animal Health and the relevant terrestrial and aquatic codes. So there is no space for the European Union and the member states to deviate by the binding rules that we have adopted in such sense. Of course, binding rules means also that there should be in place rigorous controls, and all the member states shall endorse and enforce all those rules. They have no other choice. What are the main tools we have in place in the European Union for disease controls? As we have mentioned already, we base our tools on the fully harmonized veterinary legislation. Means we have in place specific control directives, regulation. We have put in place the contingencies plans, which are adopted normally in the peacetime. Means all the member states are already aware what they have to do if there is the possible occurrence of any animal disease. We use also the regionalization policies. We use the help of the European Reference Laboratory Network. Those are laboratories which are spread in Europe. There is one main laboratory which makes a network with the other laboratories. They help especially on the disease detection. And we have also to say something which is very important. Member states are not alone when they develop the policies, the enforcement of the policies. They receive also money for doing that in the proper way. Sometimes in the animal disease we have some problems. We are obliged to destroy animals, to disinfect the stables, the farms and so on. But this is not a problem for us because member states are helped through the so-called co-financed eradication programs. Nobody is left when they fulfill and then follow the European legislation. The other tools we have at our disposals are in relation with enforcement. When we say that the European member states are obliged to follow the rules, so the legislation is binding for them, means that the European Commission use their own tools to verify the compliance of the member states with such provisions. We carried out audits in the member states. There is a directorate in DG Sante, which is based in Grange, where more than 180 people work, and they carried out during the years the audits in the member state and also in the no-EU member states. There is a program which is developed on the basis of assessments, and then we follow it. If by chance during audits we detect something that is not anymore in line with the European legislation or with the expectation, we put in place the so-called recommendation for obtaining the rectification of the things which are not going as they should do. For helping also our member states to be in line and being sure that those provisions will be adopted and followed, we have also the specific training programs for the member states and also for the trade partners called the Better Training for Safer Food, which is, as I said, developed also for non-EU countries. What we do during those training, we try to help the member states to understand what and where could be deficiencies, how to rectify, exchange experiences on what is the best way to deal with, and to find a common solution to have the best solution if needed. Of course, this kind of cooperation is developed at the international level. I was referring before to the OIE, the World Health Organization, also with the Food and Agriculture Organization, which is the FAO, and through the so-called GFTADS, the group for transboundary animal disease. We use also the expertise of our European food safety authorities, which is based in Italy, that we use for the proper assessment of the situation. We go back to them if we have doubts on possible scientific advices, how to best arrange and conduct our control for the main diseases maybe occurring in Europe. Again, as a tool for controls, we use the so-called IT platforms. I refer, for example, to Traces. Traces is one tool which has been developed during the last decades in Europe. It ensures the traceability of all animals and food products along the food chain, one step afterwards, one step before. So in any moment, we are able to know where the animals are, where the products are, which is the final destination, and in case of occurrences of diseases or food crisis, we can act very quickly to recover and to recall from the markets possible commodities which are not fulfilling the European legislation. This job is, of course, helped with the national and the network of the European laboratories, which have developed very harmonized analysis system in order to be sure that there are no false expectations or not negative outcomes whenever we record to them. We use also other IT systems, which is the animal disease notification systems. We are binding to notify the occurrence of any animal disease, notifiable animal disease, to the OIE and to the trade partners, which are fully trusted in our quick notification on any possible problem. But the prevention of the controls in Europe means that we try also to avoid that by chance possible animal disease are introduced by the third countries, no European third countries. What does it mean? It means that Europe, before allowing the imports of live animals or products of animal origin, are preventively authorized. It happens through the so-called audit procedure. We go on the spot, we check and assess the power of the competent authorities, how is the system in place, the guarantees that they can provide to us, how fast and the power of the competent authorities to suspend the trade in case of detection of animal diseases. And only by having ensured that all those pillars are guaranteed, I would say, the European Union can authorize that the trade partners to export in Europe. But I will come back on it because this is really an interesting part of it. I will show you at the later stage more details on how the European colleagues evaluate the performance of the competent authorities. Not last tool for controls of our animal disease in Europe is the vaccine banks, which means that we have stocked for emergency issues some vaccine for possibly make this vaccination whenever there could be the occurrence of a particular disease in Europe. Until now, we have used it in very few occasions in the past for specific diseases which occur in the EU, like classical swine fever, like foot and mouth disease. To summarize, the European veterinary control system, we could say that is based on four main pillars. The pillars of the prevention, which is based on biosecurity, animal identification, veterinary certification, and the movement control for intra-EU trade of livestock, veterinary certification and border controls for animals and products imported by other trade partners. The second pillar is the detection. We base it with the tools on surveillance, reference laboratories, health monitoring in high-risk areas, animal disease notification system. The third pillar is the control of the disease. It comes through the contingencies planning, animal disease notification system, isolation of infected holdings, eradication, and the EU support, which come through the emergencies team, vaccine banks, compensation, and training. The last pillar is in relation to the transparency of the EU actions. The EU member states are audited we are auditing their veterinary services, the competent authorities. We make those information available. We have the connection with the public information system through the IT platforms, RAS, Rapid Alert for food and feed, and ADNS system for notification of the disease. We have and carried out scientific consultation with our European agency, and we follow strictly the notification principle with the trade partners and with the international organization. Let me enter now in the specific of the regionalization approach and the European Union key factors. This is a comprehensive strategy which is covering prevention, early detection of the disease, control and eradication of the disease. We have the competent authorities of the veterinary services. They have inadequate resources and legal standing. This is fundamental. Without having powerful, competent authorities, we cannot do anything. We adhere to international standards. We don't deviate for them because this is important for sure a certain level of confidence. We look to have the transparency. We use the system, we communicate with the partners. We don't want to hide anything. The situation is the situation as it stands. So, confidence. Building trust, it's the most important issue for us. For applying the regionalization, we use, as I said, the international standards. For example, the Article 6 of the WTO, World Trade Organization, on sanitary and phytosanitary agreement. In this chapter, there is the reference to the zoning of the OIE. It is included in the Terrestrial Animal Health Code, and there is a specific definition for it. You are fully aware of this, so most probably there is no need to explain to you even more. So what is the message? Everything is based on international standards. What does it mean in practice, the application on the EU regionalization? We have clear defined roles for the Member States and for the European Commission, clear criteria, clear principles, rapid flow of information. We need, if it is the case, of urgent adoption of emergency measures, measures which are agreed with the Member States, as we have with them on regular basis, on monthly basis, even more if necessary, the regular, so-called regular committees, the so-called PAF. And we shall ensure that all the measures are immediately applicable. We need at the maximum an interval of 24 or 48 hours for having in place all the measures to fight those diseases. And whatever we do, we take the decision, and all those decisions are published in the official journal of the European Union. Means what we do is completely transparent for our member states, for our stakeholders, for our parliamentary people, and also for the trade partners in the world. Regionalization in the EU is applied, as I said, in line with the international standards, which is an integral element of the EU comprehensive strategy. What we want to achieve is to ensure the best possible disease control. If we are not able to do, we lose the credibility, we are downgrading our system, and we cannot ask for the trust for our trade partners. On the other side, we also need to minimize the negative impact of the disease outbreak in the EU. We cannot hide it. The trade shall continue, but only on the safe basis. We want to export to trade partners without exposing our trade partners to any risk, without lowering the level of the safety of the commodities that we are already exported. We are trying to put in place what we call trade facilitation tools. Means, in few words, trade, yes, but safe trade. It would be a pleasure for me to show you an overall map on what is and how is describe the application of the regionalization. Normally we use to split the zone in Europe with 4 different colors. One color indicates the presence of the African swine fever, which is the very specific and the high-risk zone. Then we have another zone where for example, of the African swine fever, we have the disease only on the wild boars and not in the domestic animals. Another zone where we put in place the so-called the buffer zone, the protected zone, to avoid that animals can go, or products of animal origin can go out from this zone. And then we have even another colored zone which is applicable only for one island in Europe, is the case of Sardinia. It's a particular case which goes back in the years, almost 40 years, and then for several reasons we have not yet eradicated, but it is completely isolated by the occurrence of other strains. Let me go back on the authorization of the European Union to have a trade with other partners. Before to authorize the controls, to authorize the trade partners to export towards Europe, we need to have them listed under the health animal status. We need to check with them if they have in place a regular and rapid information to us in the case of, and to the OIE, in the case of detection and occurrence of the animal health diseases. They should have in place measures which are at least equivalent to those already in place in the European Union. They should demonstrate to us that they have reliable laboratory test results. They should have a good structure of the competent authorities and the veterinary services, and then they should really convince us on their powers to adopt any measures, any initiative in case of occurrence of animal diseases. They should show us their organization and implementation of the controls as we have in European Union. They should be reliable when exporting and also when they import, because the same rules we are asking to them, to us, we ask to them. So they have to be sure that when they import in their countries are adopting similar animal health provisions. We, anyway, keep the right to audit such trade partners to see that what they declare and what are our expectations are fulfilled. They have also, as a last point, not the least, but one of the most important, they show us and demonstrate to have a safeguard measure in place, solid, in case of occurrence of animal disease or whatever other food crisis. Let's have a look now what does it mean for us trade and the importance of trade with our partners. We don't do, according with our legislation, no discrimination for the movements between the member states, the so-called intra-EU trade, and what we export to the trade partners. Why there is no discrimination? Because we apply the same animal health provisions unless the trade partners ask for different approach or different requests. We can accommodate if those additional requirements are not in contrast with the international standards. What we can clearly say that until today, we had never recorded any spread of animal disease through the international trade, means for us through the EU export. We never receive any complaint by the trade partners that a disease has been brought outside the territory of the European Union. Of course, this is based on the full trust with the trade partners, with the full cooperation and exchange of information with the trade partners, Of course, we take an engagement from our side if, by chance, we have the occurrence of any animal disease. We record to the early notification. Means we alert, we communicate with the trade partners about this possible occurrence. And then, of course, with all the trade partners, we have the special rules which could be enforced by bilateral, regional approach, or through any particular trade or veterinary agreement. Ladies and gentlemen, thank you very much for your attention. It was a pleasure for me to explain a little bit how works the system. I strongly believe that we do the best from our side to build our cooperation with you, and we expect the same from your side, because a common strength, common efforts will lead us to have really a world without the animal disease. Thank you very much. It's a pleasure.